So if you're here today, you've likely already learned the basics about ALS. Consider this as a quick refresher. For more information, please refer to the new Patient Experience Guide. ALS is a disease of the nervous system causing progressive muscle weakness. What part of the body ALS symptoms start varies per individual. Some symptoms will start in the arms or legs, whereas others will have symptoms starting with speech, swallow, or respiratory system. While there is no cure for ALS, several treatments can improve quality of life and may also modestly extend survival. For more information regarding treatment options, please speak with your neurologist or medical provider. There are approximately 30,000 individuals living with ALS in the United States, with approximately 6,000 individuals diagnosed each year. The most common ages of diagnosis are between 40 and 70 years of age, with 10% having a genetic form or familial history. Most caregivers are very familiar with the physical decline brought on by ALS. What some may not be aware of is that up to half of people diagnosed with ALS can develop some change in the level of thinking. This can range from difficulty with complicated tasks to a more severe and debilitating dementia. If your loved one shows signs in their thinking or personality, please be sure to bring that to their medical team's attention. Individuals diagnosed with ALS care might receive their medical care in a clinic. A multidisciplinary clinic involves a team of specialists working together to better impact your loved one. The clinics have been proven to extend quality of life and may also extend survival. One clinic visit may last 3 to 4 hours as it covers most needs of your loved one. The role of the caregiver while meeting and communicating with the clinic team is very valuable in ensuring that the needs of your loved ones are being met. That role can also vary depending on the level of progression of your loved one, if speech is affected, or the role that they would like for you to take. Some are very vocal in the beginning, while others are hesitant and prefer that the caregiver assist with communication. It's very important that the providers hear your loved one's wishes and concerns to be able to truly understand your individual needs. As a caregiver, you will want to periodically check in with your loved one to confirm that they are comfortable with the current role that you are supporting them through, including speaking on their behalf, note-taking, phone calls, or emails to the clinic providers, as that role can change. ALS United clinics follow best practice standards. So while we're talking about clinic care, let me introduce some of the members of the team that you'll see. The neurologist is the primary contact for the medical care. The neurologist will guide the team and write orders based on the recommendations of the rest of the team as far as care and equipment. Pulmonology will help to manage the respiratory treatment in conjunction with the respiratory therapist based on the reporting of pulmonary testing. Some, but not all clinics may have access to palliative care. The palliative care provider is a clinician who works with individuals to help them maximize comfort and help them to define what they feel is quality of life. The clinic nurse will be a point of contact for you in between clinic appointments or during clinic time. And the social worker can help to connect you to community resources as well as emotional support. Further, ALS clinic team members include physical and occupational therapists. These therapists are key in helping to evaluate the function of your loved one to optimize their ability to continue to participate in meaningful daily activities. The rehab team will also evaluate for assistive devices as ALS progresses to maximize independence. What's important to realize here is with this disease, families will often say, "I need this equipment right now." The value of physical and occupational therapy during these meetings is to help you to receive the right equipment at the right time and to guide you on when that equipment's necessary. Speech therapy will play a crucial role in helping your loved one to continue to be able to speak and communicate effectively. Speech therapy also works closely with the dietitian to assess and manage swallow difficulties. That leads us to the registered dietitian. The dietitian will help to maintain and evaluate nutritional challenges associated with ALS, including the assessment and evaluation for swallowing difficulties and timing of appropriateness for a feeding tube. The dietitian may also suggest ideas for meal planning for caregivers. If you are the caregiver providing the meals for your family, it's important to familiarize yourself with changes in food consistency, differences in preparation, for example, whether your loved one is on a pureed diet, a thickened diet, finely chopped, as well as eating utensils. For example, anti-gravity utensils, lighter weight utensils, foam grips for pencils and pens. And your ALS care coordinator will help to provide education in connecting the team's recommendations to your family. As a caregiver, here are some important things to keep in mind. Take notes and ask questions at appointments. Explore your family medical leave benefits along with potential opportunities to work remotely. Remember to care for yourself. Be an active part of the care team by being a gentle voice and giving the team a true and accurate voice of what your loved one might not be ready to discuss. For example, if the number of falls between clinic appointments is being minimized by your loved one, think about how you might share this information with the team and be careful to not force your loved one into taking a defensive stance. Your ALS care coordinator is here to help you navigate your role in best supporting your loved one throughout the disease process. Advocacy is a powerful tool that drives meaningful improvements in the lives of your loved ones living with ALS and their families. Together, caregivers can be a very loud voice on behalf of the ALS community, influencing policies that directly impact daily care. This includes speeding up insurance approvals, improving access to necessary medical equipment, and enhancing home health support services, all of which contribute to a better quality of life. Our care services coordinators are always interested in hearing your struggles to better assist in guiding organizational advocacy efforts, making open communication key not only for you and your loved one, but also for others in the future. Significant advocacy achievements have been made through ALS United and collaborative organizations, including increased federal funding for ALS research, which accelerates scientific progress. The Medicare waiver for ALS patients eases access to care, while Social Security's presumptive disability ruling simplifies benefits. These are examples of achievements on a federal level. An example of advocacy on a state level might be Indiana's passage of the Medigap law, which became effective in January of 2025. This new law gives disabled individuals diagnosed with ALS or end-stage renal disease access to the same Medicare supplemental plans at the same cost as individuals over the age of 65. Check with your state for local advocacy opportunities. Caregivers don't need specialized expertise to advocate effectively. Sharing personal stories with legislators or through written communication can influence policy. Participating in ALS advocacy events and campaigns strengthens community efforts. Importantly, caregivers can empower their loved ones by representing their needs and concerns when they are unable to do so themselves. Families will often ask how they can participate in research. One example might be the CDC ALS Registry, which is a vital national resource that tracks ALS cases and trends, helping researchers to understand the disease better. Because the registry is a series of surveys, it can be very time-consuming. Your support to your loved one in completing the surveys is a way everyone can participate and contribute to research. It also connects your loved ones with research opportunities that may lead to new treatments. Caregivers should encourage their loved ones to keep their information up to date to ensure accurate data and maximize potential benefits from ongoing studies. We all recognize that caregiving can be very overwhelming. When I'm meeting with a family, I like to help them to identify formal and informal supports. Informal supports might include family and friends who live outside of the home, neighbors, church, and social communities. These helpers can assist with companionship, errands, meal preparation, and light household chores, providing much-needed relief to you as the caregiver. Your care service coordinator can help you identify and arrange your family and friends to help. A simple statement such as, "Let me know what I can do to help you," might be overwhelming to the caregiver as it burdens them with identifying a task. When someone says that, don't be shy. Suggest that a friend roll the garbage can out, rake the leaves, pick up groceries, prepare a few freezer meals. People love to help, and by you allowing their help, they can be encouraged to stay available to you and your loved one. Non-skilled care would be a part of a formal support that I spoke about. Non-skilled care options provide essential support for daily living activities such as cooking, cleaning, grocery shopping, and laundry. These services may be funded through government programs such as the Department on Aging or Rehabilitation Services or the Area Agency on Aging. These programs are often based on income. You might also determine whether you and your loved one have access to private pay resources along with long-term care insurance options. Please note that a non-skilled caregiver is limited in their scope of practice. They are not able to provide certain tasks such as giving medications, placing respiratory equipment, or administering tube feeds. Skilled home care or formal support involves professional medical services that may be covered by Medicare or your insurance if your loved one is homebound. This includes therapies like physical therapy, occupational therapy, and speech therapy, as well as nursing care for medical needs such as wound management or respiratory therapy. Home health agencies may also provide a social worker and certified nursing assistant, addressing both medical and emotional needs. Skilled home care requires a physician order and often a face-to-face visit with a provider. These services are also referred to as intermittent and temporary, as they are not a replacement for daily care of your loved one. Clinical trials offer opportunities for your loved one to access new treatments, though participation often requires travel and may involve placebo controls. Caregivers play a key role in coordinating the logistics and providing support during these trials. Some of the resources you might look into include the CDC ALS Registry, NEALS.org, and the I Am ALS Signal Dashboard, which can all help to identify relevant trials and provide important information. You are an important part of the advocacy team. Caregivers are integral members bringing firsthand experiences that shape care policies. Their voices help to ensure that future individuals diagnosed with ALS and their caregivers benefit from improved resources and support systems. ALS United is committed to supporting caregivers through guidance and advocacy efforts, reinforcing that together we can bring meaningful change.